Hi, everybody. Here are the big takeaways for Chapter 15 on childhood disorders. First of all, first big takeaway. Here's a tip to help you remember the difference between externalizing disorders and internalizing disorders. Externalizing disorders have symptoms that are on the outside. Think external. Think like ADHD with hyperactive behavior, or conduct disorders with behaviors like assault and violence, things like that. Externalizing disorders have the symptoms on the outside, they're external. Internalizing disorders have symptoms that are on the inside, so they're internal. Symptoms, think like depressive symptoms, anxiety, low self-esteem, stuff like that. The second big takeaway, childhood disorders are distinct in this course for several reasons. Remember, all semester we've been talking about adult disorders. Childhood disorders are distinct for several reasons. First, let's keep in mind how different normal children's behavior and thought processes are, how different they can be from us adults, especially if you yourself do not spend a lot of time with children on a regular basis. When we diagnose children, we must first subtract the idiosyncrasies of normal childhood. Remember, kids are a little strange to us adults sometimes. I got two of them, and they're a little strange because they often act in unfiltered ways, in kind of non-self-conscious ways. By contrast, adults tend to be quite self-conscious, quite aware of proper behaviors in public spaces versus private places. Unlike adults, kids tend not to worry, especially little kids, tend not to worry about being viewed awkwardly if they sing to themselves in public, if they're on the sidewalk and they run a few steps and then walk a few steps and then run a few steps, if they stop and tell a complete stranger that they got dressed all by themselves this morning and they're really proud and excited about that. The point is this. The first thing about childhood disorders, when we diagnose children, we must first subtract what is the idiosyncrasies, what is sometimes just kind of weird about kids to begin with. Then look for abnormality in whatever is left, in the behaviors, thoughts, and feelings that are left behind. Let's keep in mind how different normal children's behavior and thought processes can be, especially again if you don't spend a whole lot of time yourself around small children. The second thing unique about childhood disorders, distinct, the diagnosed client, which is the child, right, is often not the primary source of diagnostic information or symptoms. It's often the parents, the teachers, the caregivers who we talk to provide the symptoms for us to make a diagnosis. The client, who is aged like 4 to 10, is often simply not able to describe their thoughts or their emotions that underlie the behavior, like low mood or guilt or shame or things like that. Those abstract concepts are too complex. Kids can only describe them in a very basic way. They'll say like, I'm sad, or my stomach hurts, or something like that. The primary information doesn't come from the client. Isn't that interesting? That's different. It comes from other people. And the third and the last way that childhood disorders are pretty distinct, adult diagnoses that we've studied all semester, such as major depressive disorder, bipolar disorder, generalized anxiety disorder, schizophrenia, these diagnostic labels should not be applied to children. Even though you may have seen this in a television show or a talk show or radio show, this is a controversial topic, but there's a good reason that we don't apply these diagnostic labels to children. First good reason, psychologists cannot verify the symptoms with small children because the children often cannot comprehend our questions about such abstract adult concepts like feeling stress or depressed mood or lack of motivation. Kids don't understand the question, so they can't give us their symptoms. Again, we rely on other people, right? The other good reason why we don't apply adult diagnostic labels to children, we don't gain any benefit from it. Psychologists do not benefit from applying adult diagnoses to kids because often we cannot use the prescribed adult treatments like drug therapy or talk therapy. Just think about it. Our standard drugs have not been tested on kids, and most parents would not allow us to experiment with their kids. Also, talk therapy is about very abstract concepts like desires and stressors, again, that little children could just not comprehend. So adult diagnoses like depression and anxiety, schizophrenia, should not be applied to small children, even though you might have seen this. It's a controversial topic on television and articles. Shouldn't be done. The third takeaway for this chapter regarding the etiology, the cause of autistic spectrum disorder, we just call it autism for short. We don't know what causes it. Many individual studies have proposed specific causes like food additives or vaccines, which has nothing to do with it, but no pattern has yet been observed. So to be clear, we do not know what causes autism, also known as autistic spectrum disorder. The next big takeaway regarding understanding causes of children's behavior, and let's refer to that PDF article that's in this module called Poor Parenting. This poor parenting article represents a point of view that is popular but quiet. The reason for this is because it can often make some parents uncomfortable. The truth is that behavioral problems have many factors that contribute to them, and parents should be open to learn self-improvement in parenting to see if it has a positive impact. And that relates to my last takeaway regarding treatment for childhood disorders. While we don't do talk therapy with children, a substantial part of treatment for childhood disorders does involve training the parents to do the same types of interventions on a daily basis that a psychologist can provide only once a week. There's several benefits here. The first benefit is obviously for the child. The increased frequency of daily therapy from trained parents is better for the child. Parents are living with them, they're present every day, they're more invested than anyone to help the child, to offer assistance, to offer support. A psychologist, on the other hand, is expensive and they're only available about once a week at the most. The second benefit to training the parents is this helps the parents feel like better parents. That's important. That's not a small matter. Remember that by the time parents come to the clinic to ask for help for their child, parents may have a wounded sense of their parenting abilities after weeks or months or even years of struggling with their child. So using and teaching these new skills help parents feel better too. They feel effective, they see some results, and they feel like they can be better parents. And they often need that by the time they come see us. So in summary, the big takeaways here, childhood disorders are pretty distinct for several different reasons. When we diagnose, we first have to subtract some normal idiosyncrasies, some normal weirdness in kids. They just don't behave like adults. Remember that the source of diagnostic information is unique. It's not the patient, it's not the child. The source of information comes from others. Also, adult diagnoses should not be applied to small children because we cannot verify the symptoms, and the label doesn't help us with the normal diagnostic treatment interventions we would use with adults. We can't do those with kids anyway. Second thing is the etiology, the cause of autistic disorder. Let's be clear. We do not know what causes autism despite claims otherwise. Those are the big takeaways from Chapter 15 on childhood disorders. Thanks, everybody.